If you think lowering your cholesterol is the only way to prevent a heart attack, you are playing Russian roulette with your life. Here is a statistic that should terrify you, but instead it gets buried in medical journals. 50% of all heart attacks happen to people with normal cholesterol. Let that sink in. Half the people being rushed to the ER, clutching their chests, have lab results that their doctors said were perfect. They did everything right. They took the pills, they ate the oatmeal, and they are still at risk. Why? Because for decades we have been obsessed with the wrong enemy. Cholesterol is the fuel, but it is not the match. Today, I am going to show you the real driver of heart disease. It's a hidden metric that 60% of global deaths are linked to, yet most seniors never get tested for it. By the end of this video, you won't just understand why the system failed you. You will have the exact testing protocol and an 8-step plan to fix it. I have been in this field for over 20 years. I have stood at the bedsides of patients who looked up at me in confusion and asked, "But doctor, my numbers were fine. How did this happen?" I've seen it over and over again. It is a pattern that the standard medical system misses because they are trained to check boxes, not connect dots. The system checks the plumbing, the cholesterol pipes, but it ignores the condition of the pipes themselves. So, what is the missing link? It is one word: inflammation. Think of it this way. Cholesterol is like a bandage. Your body uses it to repair damage. If you have no damage, the cholesterol just floats on by. It's harmless. But if your arteries are inflamed, if the lining of your blood vessels is red, raw, and sticky, that cholesterol gets trapped. It's not the grease in the pipe that's the problem. It's the rust on the pipe that grabs the grease. Inflammation is the driver. Cholesterol is just the tool. If you have high cholesterol but zero inflammation, your risk is vastly different than someone with low cholesterol and high inflammation. But your doctor is likely only treating the cholesterol. Why don't you know this? Because the industry is built on a one-size-fits-all model. It is easier to prescribe a statin than to fix the root cause of inflammation. It is easier to blame you for not trying hard enough than to admit the test they gave you was incomplete. You are being misled, not out of malice, but out of inertia. But right now, there is a silent biological process happening inside your arteries that a standard lipid panel cannot see. Stay with me. I'm going to give you the specific blood test, the hidden metric you need to ask for. But first, you need to understand the stakes. Let me tell you about a patient I'll call David. David was 68. He was the model patient. He walked 3 miles a day. He wasn't overweight, and his LDL cholesterol, the so-called bad cholesterol, was 85. For context, anything under 100 is considered excellent. His doctor told him, "David, you have the heart of a 40-year-old. Keep doing what you're doing." 3 weeks after that appointment, David collapsed in his kitchen. Massive heart attack. When we looked at his angiography, he had a 95% blockage in his left anterior descending artery, the widowmaker. How does a man with an LDL of 85 get a 95% blockage? We ran the test his previous doctor didn't. We tested his hs-CRP. That stands for high sensitivity c-reactive protein. It's a marker of systemic inflammation. A safe level is under 1.0. High risk is anything over 3.0. David's level was 9.2. Here is what was happening inside David, and what might be happening inside you right now. Because David's inflammation was so high, his immune system was constantly attacking his artery walls. This creates a sticky site. Even though he didn't have much cholesterol, the little bit he did have got stuck in that inflamed mesh. His body sent white blood cells to clean it up. But because of the chronic inflammation, those cells got overwhelmed. They turned into something called foam cells. These foam cells harden and form plaque. Eventually, that plaque didn't just sit there. Because of the inflammation, the cap of the plaque became weak and unstable. It popped. A clot formed. Boom! Heart attack. The cholesterol provided the material, but the inflammation caused the accident. Now I know that sounds terrifying. I could be David, you're thinking. But let's flip the script. Let's look at the other side of the coin. Let me tell you about Margaret. Margaret was 72. Her cholesterol was sky high. Her LDL was 160. Her doctor was panicking, telling her she needed high-dose statins immediately or she was a ticking time bomb. But Margaret didn't want to take medication if she didn't have to. She came for a second opinion. We ran the full panel. Yes, her LDL was high, but her hs-CRP? It was 0.4, practically zero inflammation. We did a CAC scan, a calcium score, to look for actual plaque. Her score was 0. Margaret had high cholesterol, but because her arteries weren't inflamed, the cholesterol wasn't sticking. It was just flowing. 10 years later, Margaret is 82. She is still hiking. She never had a heart event. If we had treated Margaret like a statistic, we would have forced her onto medication she didn't need. If we had treated David like a statistic, we would have told him he was safe while he was dying. This isn't just my opinion. This is backed by hard science that takes years to trickle down to your local clinic. Look at the Jupiter trial. This was a massive study. It looked at people with normal cholesterol but high inflammation. They found that lowering inflammation reduced heart attacks significantly, even though their cholesterol wasn't the main problem. Then there was the CANTOS trial. It proved that targeting inflammation directly, without even touching cholesterol levels, cut heart attack risk by 25%. And yet we have this phenomenon called inflammaging. As we age, our bodies naturally produce more inflammatory markers. It's the slow burn of the immune system. This is why age is the biggest risk factor. It's not just that your parts are old, it's that your fire is burning hotter. So, where does this inflammation come from? This is the good news. Unlike your genetics, which you can't change, inflammation is almost entirely driven by things you can control. You might feel powerless when you see a lab report, but you are not. The major drivers are visceral fat. That's the hard belly fat underneath the muscle, sugar intake, and inactivity. I've seen patients drop their hs-CRP from a dangerous 6.0 to a safe 0.8 in 6 months, just by changing what they ate. You are not doomed to be inflamed. Now, I can hear the question bubbling up. I see it in the comments all the time. If this is so important, why didn't my doctor test me for it? Why is he pushing statins if they aren't the whole answer? I want to be clear. Your doctor isn't evil. They are operating within a system that lags behind science by about 17 years. That is the average time it takes for a research breakthrough to become a standard guideline. Insurance companies pay for standard lipid panels. They fight back on experimental tests. Doctors are pressured to get your LDL number down because that is the metric they are graded on. It is a metrics game, not a total health game. Does this mean statins are trash? No, absolutely not. For some people, like those with established heart disease, statins are life-saving. And guess what? Statins actually have a mild anti-inflammatory effect. That's part of why they work. But taking a statin without measuring inflammation is like wearing a seatbelt but driving with your eyes closed. You need the full picture. So, let's get practical. You want to know what to do. You want to know, how do I fix it? Here is your diagnostic protocol. Grab a pen. You need to ask your doctor for these specific things. If they refuse, ask them to document their refusal in your chart. Usually that changes their mind. Number 1. The hs-CRP test. Make sure it is high sensitivity. A regular CRP test is for acute infections like pneumonia. You want the high sensitivity one for heart health. Ideally, you want this number below 1.0. If it is between 1.0 and 3.0, you are average risk. Above 3.0, you are in the danger zone. Number 2. The CAC scan. This is a coronary artery calcium scan. It's a CT scan of your heart. It takes 5 minutes. It tells you if you already have hard plaque. It is the ultimate tiebreaker. Number 3. Lipoprotein A. This is a genetic form of sticky cholesterol that statins don't touch. You only need to test this once in your life. If it's high, you need to be aggressive with inflammation. Okay, you've got your tests. Now what do you do tomorrow morning? How do you lower inflammation? Based on the thousands of comments asking, what is the solution? Here is your 8-step action protocol. Step 1. Eliminate the secret sugars. Insulin spikes drive inflammation. It's not just cake. It's the bread, the pasta, the healthy fruit juice. Cut the liquid sugar immediately. Step 2. The oil change. Stop using seed oils that are high in omega-6, like soybean, corn, and canola oil. They are pro-inflammatory. Switch to extra virgin olive oil and avocado oil. Olive oil contains oleocanthal, which works like natural ibuprofen for your arteries. Step 3. Omega-3 loading. You need to balance the scales. Eat fatty fish, salmon, sardines, mackerel, 3 times a week. If you can't, take a high-quality fish oil supplement. You want at least 2 grams of EPA-DHA daily. Step 4. Visceral fat attack. Measure your waist at the belly button. If it's more than half your height, you have visceral fat churning out inflammatory cytokines 24/7. Walking after meals, just 10 minutes, is the single best way to lower the blood sugar spikes that build this fat. Step 5. Dental hygiene. This sounds crazy, but oral bacteria from gum disease can enter the bloodstream and cause arterial inflammation. Floss. If your gums bleed, your heart is at risk. Step 6. Magnesium. Magnesium deficiency is rampant in seniors and is linked to higher CRP. Eat leafy greens, pumpkin seeds, or consider a glycinate supplement. Step 7. Sleep quality. Poor sleep raises CRP overnight. If you snore, get checked for sleep apnea. Sleep apnea is a massive inflammation generator. Step 8. Retest. Don't just guess. Implement these changes for 3 months, then ask for another hs-CRP test. Seeing that number drop will motivate you more than any video I can make. Listen, heart disease doesn't have to be a surprise. It is only a surprise when we aren't looking at the right map. David's story was a tragedy because he thought he was safe. Margaret's story is a triumph because she looked deeper. You have the power to be Margaret. You now know more than 90% of the patients sitting in waiting rooms today. You know that cholesterol is just the passenger and inflammation is the driver. Now, I have a favor to ask, not for me, but for the people you love. We all have that friend or family member who is obsessing over their eggs and butter, but ignoring their stress and sugar. Share this video with them. You might just save a life. And if you want a deep dive into exactly which foods act as natural anti-inflammatories, I've linked my guide in the description below. Don't wait for the system to catch up. Take control of your health today. I'll see you in the next video.